Hello my dear pharmacist friends, welcome to this new pharmacy MCQs video. In this video again we are going to solve a new set of 10 MCQs along with solutions and explanation as much possible. So please be with me for the whole duration of this video so you will learn something out of it. So our first MCQ, the principal indication or indications of corticosteroid therapy. So option A is inflammatory states, option B severe hypersensitivity reactions, option C is lymphomas, option D transplantation, and last option all of the above. Corticosteroid therapy has indications in all these states, that is inflammatory states, severe hypersensitivity reactions, lymphomas and transplantation. So E is the correct option here. Our second MCQ, millipoise is the unit for the measurement of. So options are viscosity, equilibrium, bioelectricity, total muscle mass, pH and pKa ratio. Actually, millipoise is the unit for the measurement of viscosity. Now the third MCQ, von Willebrand disease is characterized by impaired oxygen transport capacity of hemoglobin, impaired iron absorption, impaired platelet aggregation, impaired hematopoiesis. Hematopoiesis is actually blood cells formation. And the last option is impaired blood-brain barrier or BBB. Actually, von Willebrand disease is characterized by impaired platelet aggregation. It is actually a clotting disorder in which blood will not clot properly during accidental situations like injuries or traumas, etc. Now our next MCQ, heparin-induced thrombocytopenia can be treated with one of the following classes of drugs as the first choice. So options are serine protease inhibitors, protamine sulphate, direct thrombin inhibitors, thrombolytic drugs, and fibrinolytic inhibitors. Actually, heparin-induced thrombocytopenia, or in short HIT, it is actually a complication of heparin therapy. Heparin-induced thrombocytopenia is a potentially devastating immune-mediated adverse drug reaction caused by the emergence of antibodies that activate platelets in the presence of heparin. So when this occurs, that is heparin-induced thrombocytopenia, the blood tends to clot more easily. So direct thrombin inhibitors are actually given as a first choice to treat this condition, heparin-induced thrombocytopenia. And direct thrombin inhibitors includes lepirudin, danaparoid, argatroban. Patients on chemotherapy with Nilutamide can experience a certain adverse effect for which they should be advised to. Options are wear loose clothing, wear thick clothing, wear tinted glasses, wear dark clothing, wear a white cap. Actually, nilutamide is an anti-cancerous drug and it is used in the treatment of prostate cancer. And while patient is on this drug, they can experience a certain adverse effect, that is when the patient is in light for a certain period of time and suddenly he comes into a dark room, then he will experience a certain loss of vision for a certain period of time. Actually, this is normal also in normal situations. When you enter a dark room from the lighted area, suddenly then you experience that loss of vision. But when you take this drug nilutamide, it actually increases that loss of vision duration. And so the patient is advised to be aware of this adverse effect and he can minimize this adverse effect by wearing tinted glasses. So C is our correct option here. Now the drug-induced parkinsonism can be treated with one of the following agents. Options are ondansetron, pimozide, a-serine, procyclidine and e-tegaserod. This drug-induced Parkinsonism, it is actually also a side effect of typical antipsychotic medications. And for this, we can give one of the following agents, and that is procyclidine. It is actually an anticholinergic drug, and this is used in the management of complications that are caused by typical antipsychotic medications like haloperidol, chlorpromazine, etc. So D is our correct option here. Now the next MCQ, beta 2 adrenergic receptors are located in, options are lungs, gastrointestinal tract, liver, uterus, and all of the above. Actually, beta 2 adrenergic receptors are receptors of the sympathetic nervous system, and they are located in all of these sites, that is lungs, GIT, liver, and uterus. So all of the above is our correct option for this MCQ. Now the 8th MCQ of this video, beta blockers are agents that will decrease the sympathetic activity in the body. But there is an agent in the options list that has intrinsic sympathomimetic activity. Identify which one. Options are atenolol, propranolol, penbutolol, metoprolol, and bisoprolol. Actually, beta blockers will decrease the sympathetic activity, but there are some beta blockers that have intrinsic sympathomimetic activity, meaning that they will increase the sympathetic activity also to some extent. So these are actually classified as beta blockers with intrinsic sympathomimetic activity or beta blockers with ISA. Friends, we have to remember these three drugs that are beta blockers that have intrinsic sympathomimetic activity. These are pendolol, acebutolol, and penbutolol. So penbutolol is here in our options, and this is our correct option here. Now moving on to the second last MCQ. One of the following NSAIDs is more GIT friendly than the rest. Identify which one. Options are diflunisal, ibuprofen, naproxen, piroxicam, and celecoxib. Actually, those NSAIDs are more GIT friendly that have selectivity preferentially for COX-2 enzyme. And here in these options we have celecoxib that has more COX-2 selectivity. So E is our correct option here. The rest of the options are not so much GIT friendly because they have activity on COX-1. Our last MCQ of this video, beta 1 receptors are located commonly in the, options are heart, kidneys, both heart and kidneys, liver, and pancreas. Actually, beta 1 receptors are located commonly in the heart and kidneys. So C is the correct choice here. Friends, this was enough for this video. Thanks for watching. I hope you have learnt something or other from this video. For more such pharmacy MCQs videos, subscribe to our YouTube channel.